Hi class, hope all you doing well out there. Haven't posted a video in a while, and this is going to be some housekeeping and just some updates. One, loving all your work. The discussion boards are really good. Assignments, of course, if I have any questions, I do send it back. Please don't hesitate to complete it and send back for possible full credit. The midterm is going to be about in 2 weeks, and what it's going to be is another intake form, a little different than you've used in the past, but each agency is going to have their own intake, charting, progress notes, and goals and goal updates. So I'm just trying to get you familiar with different formats, but as you see, they're all basically ask the same questions. And then depending on what type of agency you're in, may focus on different things, if it's medical or mental health. When doing the assignments and the midterm, always check the rubrics. Some of you are missing out on some points because you left a whole section out. So check the rubrics. It'll tell you how the points are scored. Of course, if you ever have any questions, don't hesitate to reach out. If you notice now, the start of the book and what we've talked about is the basics, the tools, and hopefully building on if you've taken any counseling courses, but also giving you how to interview, how to develop rapport, how to do assessments, and how to get information and then develop a plan to work with the client. We've had the crisis case handling, which goes into detail on the difference between clinical versus crisis or / case management. Just remember, if a client ever does need counseling, we're going to refer out to a licensed therapist. So we're getting the tools for our tool bag, and now we're just, from here on out, we're just going to be exploring different types of crisis, be it PTSD, crisis of lethality, partner violence, or sexual assault. So you're going to be using all these tools that we're learning, and then there's just different applications and different sensitivities in dealing with certain populations. What else? As we continue in all the assignments and the chapters, just keep an open mind to, just because you may not be dealing with that population doesn't mean you shouldn't be open to learning about it. So even if your specialty is elderly or mental health or domestic violence, you don't know what's going to be walking through that front door when you're meeting with the client. So the more understanding, great, and then you'll all develop your own expertise in what field you want to go into. But especially in the beginning of your careers, go and try as much as you can and have those experiences. One, it's a great resume builder. Don't forget volunteering is a great resume builder too. And it's about learning as much as we can so we're a well-rounded professional. So I'm not going to go into any details with specifics to the chapters. I just wanted to just touch base. Please, if you have any questions, don't hesitate to ask. And as always, I respond to discussion boards. And if I do have any questions, I will ask. If I do ask a question, please respond as part of the interaction. So great job. I think you're all doing really well. That's the beauty about, teaching this class. People choose to come to it. So I'm never having to deal with, people forced to take the class. So that's why I just enjoy doing it. So have a great day, and I will be posting more next week. All right, take care. Bye.